Welcome, everybody, back to the Health Explained show. And we have with us Dr. Tammy Moralia. And I'm so excited because she has done so many things. She's done a docuseries. She's a best-selling author. She's just done tons of things. She's just absolutely amazing. And I can't wait to talk with her and have you guys listen to how she explains some really amazing topics that I didn't even understand. So thank you, Dr. Tammy, for being with us today.
Thanks for having me.
So, just really quickly, how did you get into medicine?
A long time ago, I danced professionally in a ballet company for 13 years, actually. And I went to school thinking I was going to be a physical therapist because that was the only other profession I'd ever been, exposed to. And I just thought, gosh, I just don't know if I can do this. It's these people who come with back pain, and the majority of them didn't want to really have anything to do with healing. They just went like ultrasound or massage or whatever. And I was working at an old folks home, and I got to take care of these older people, and it was nutrition and medication and physical therapy and just this big, huge holistic thing. And I was like, gosh, this is great. And then when you go to school, and I fell in love with anatomy, and I fell in love with chemistry, and then boom, there you are, pre-med.
Oh my goodness. And then we were talking ahead of time, you have some really fun ways to describe because, I always joke, I go to the car dealership and they're like, your car needs this, this, this. And I look at them, I go, what are you talking about? And I know that's what patients feel all the time when we're talking medical conditions.
Yep.
But
We go to school for a really long time, so no one can understand a thing like this.
One of the things you brought up was super interesting is how our thoughts can affect every single cell in our body.
Yeah, literally.
How is that possible?
Well, in your thoughts and your feelings, right? So let's just back up and remember that when you're driving on the road and you hear a siren and you see flashing lights, you have this like, oh, I'm going to get pulled over. I'm going to get a ticket. But that's not all that happens. Your heart rate goes up, your respiration rate goes up, your palms probably get sweaty, and your eyes dilate. You literally have a physical response to the thought that you're going to get pulled over by the police. So how does that really work? Well, let's say you're thinking, I'm anxious, I'm worried, I'm afraid. Well, those thoughts are like the doctor. The doctor writes a prescription, right? And then where does the prescription go? Pharmacy. Now, does the pharmacist change the prescription and say, oh, you know what, that's not going to bless your life. These are all stressful medications. That's not going to bless you. I'm going to completely rewrite this prescription. They don't. They dispense what the doctor has said. So in our brains, we have this gland called the pituitary gland. And the pituitary gland is your pharmacist. Your pharmacist reads your thoughts, reads your emotions through all those electrical stimuli, and it says, okay, I'm going to dispense all the chemicals and all the hormones that perfectly match the hormones and chemicals associated with those thoughts: stress, anger, fear, resentment. And your body is then flooded and reacts, of course, because the chemicals fit the receptors and then the cells act in accordance to the instructions. So the greatest part about knowing that your thoughts and feelings can affect how your cells react literally is that if our thoughts can make stress reactions and things like that, could they heal us? And the answer is yes. We know that oxytocin is released when we're around babies and puppies and all these kinds of things. So I really think that people need to know and remember and get informed that your thoughts and your feelings are the doctor writing prescriptions. And B, you don't have to write prescriptions that are for stress. But if you do, of course, sometimes we react. Don't write a prescription for a 6-month supply. Just a moment or two, and then write a different prescription. so that it changes.
I think about that sometimes when I'm watching TV shows, like right before bedtime. And like for a while, I was watching, I can't remember the name of that zombie show. And I was wondering, like, why was I having like palpitations at night and couldn't sleep? And I'm going, oh, wait, because my brain doesn't know that, like, I'm not really being chased by zombies, but I exposed my, like, thoughts to that, like, oh, the suspense of these zombies.
Yeah, yeah, exactly. You cannot instruct the jury to disregard. It's already in there and it's going to get dispensed instantly. So, and people think your brain and your mind are the same. But, you know, your body is always eavesdropping on your thoughts. So just be aware. And if you stay in the actual present moment and you just don't worry about the future and you stop ruminating about the past, there's usually very little in that present moment to cause a stressful reaction. Not always, sometimes there is. You might be in pain or something like that. But we do have choices. We can switch the channel. We can write a different prescription.
I like that. Change that channel. And this is something that a question that I was like, I don't even remember how this works. So I'm looking forward to this explanation. How does the body use ferritin in thyroid function?
So ferritin is a measurement of iron, and we usually consider it to be your stored iron. So I tell my patients, your hemoglobin, your hematocrit are like the amount of food on your kitchen table and in your kitchen. And the ferritin is the stuff that's in your pantry. And what your ferritin does is it's actually the bus that drives your thyroid hormone, whether it's the ones that your body makes or the ones that you take as a medication, to the cell to do the work. So imagine your cell that needs to do the work is your house that you're getting built or getting renovated. And the workers are the hormone. We have to get them to the house, right? So they come on a bus or they come on a truck. Well, if you don't have enough trucks, then you're not going to get any work done. So oftentimes people need to look, or they should look at their ferritin levels and increase their consumption of iron-rich foods and make sure you're absorbing it, because iron needs an acidic environment to be absorbed in order to have your thyroid work. A lot of people say, oh, I don't feel any different. I'm taking my medication, or I think there's a problem with my thyroid. Maybe, but maybe your workers just haven't been brought over. Maybe they're ready. They just need to get a truck.
Oh my God, that's just making me think so much because, like, especially when you're talking about with the like how we need an acidic environment, and I've been wondering. You see all these alkaline waters on the market all the time, and I've been like in my back of my mind going, is that affecting us? Because it seems like weird because we know our stomach is acidic, so why are we drinking all this stuff that's not acidic? So.
Well, and you know what? Our body is like, this from your work as a physician. Our body is pH balance is very tightly regulated. You can be a little bit one way and a little bit another way, but it is one of the most important things for survival. So you can drink a ton of alkaline water and your body is just going to be like, nope, nope, nope. Come on back here.
Oh my goodness, that's a good point. What do we need to do then to keep that acidic environment so the ferritin works?
I actually tell people that, A, you can check your ferritin level, and B, just have even like some applesauce or something when you're eating iron-rich foods, so
Oh,
that there's acid there at the same time that it's trying to get absorbed.
ooh, I like that trick.
Yeah.
And
Or
then
if you're
now,
taking iron supplements, have it with applesauce.
that's a good trick. I like that. And then here we get another one. What about stem cells? So, we hear so much in the news about stem cells. And really, what is a stem cell and what does it do? Why are we talking about it?
Well, I think cellular medicine is the future. It's really, really exciting. And there's lots of different types of stem cells. Currently, almost every place in the world does not use embryonic stem cells. There's no dead babies that are being used, but there are stem cells from the birth products like the umbilical cord or the placenta, and there's stem cells from your own body. They're abundant in your bone marrow and in your fat. There are other places as well, even in your teeth. But people think that stem cells themselves turn into the new tissue, like a transformer toy, like, I'm going to become cartilage, or I'm going to become bone, etc. And that's not exactly true. So the stem cells are like a queen bee. If you don't have a queen bee in the hive will collapse and all the bees will die or move, and it'll go away. But the queen bee doesn't do any work. So the stem cells actually have all of their effect on what's called a paracrine effect. So they just communicate, they send out messengers, and some of these messengers are called extravesicular vesicles. They're just messengers. And some people might hear the word exosomes. Those are a type of these messengers. So those messengers, like the exosomes, are the worker bees. So you need worker bees, you need a queen bee, but don't mistake the stem cell itself for doing the work.
That's what I was wondering, because I always wondered, like, if you inject stem cells into an area, I'm like, how does it know what to become? Because there was this, idea like, oh, we're just going to put these in your joint and your joint's going to be better. But I'm like, well, how do I know it wants to become that?
Well, and it's fascinating. There's actually homing communication. And if you think about it, if you cut your finger, you grow skin on that finger on your finger because of your stem cells. You do not grow it on your nose. How does it know?
Wow. Yeah.
It knows because there's an inflammatory response, and that's the beacon that says, help me, help me, help me.
I like that. That's a good one too. You got really good ways to explain things and make it easy. So, and then this one is also, it's funny because my daughter the other day asked me, what does the pancreas do? And I'm like, oh my God, you're making me go back to medical school. I'm like, I don't remember. That's not my specialty. I'm like, it has to do with insulin and glucose and stuff like that. I'm like, I got to go look that back up again. But this brings up the topic, what is insulin resistance?
So insulin resistance is actually like scary common. You don't have as pre-diabetic or diabetic. Resistance happens before a diagnosis. People think that it can happen 10 to 15 years before. And so basically what happens, insulin is this amazing molecule. It's actually a hormone that takes the glucose, because every single thing that you eat except for pure protein or pure fat gets turned into glucose, because your body loves glucose as energy, especially our brains. And so that's how it does. It just turns it into glucose. And then insulin is like the most amazing worker. It takes it and it pushes it into our cells so that the cells can do the work. Now, what happens when there's too much glucose in the system, the insulin goes up, right? So you can actually see higher and higher insulin at the early stages of insulin resistance. And then what happens is these guys are completely overwhelmed, and it's kind of like your kid's bedroom. So you're supposed to put your toys on the shelf, put away where it's supposed to be put away. But if you have so many toys, your shelf is full, it's under your bed, it's on the floor, it's just everywhere because you have too many toys, or too many toys in your bedroom. It should go downstairs. What happens is your body puts these glucose molecules onto your red blood cell because there's too much, and that's called hemoglobin A1C. And that can tell us there's insulin resistance, because that goes higher and higher and higher, because your body is like, what am I going to do with this sugar? I put it on the shelf. I put it on the red blood cell. Now the cell itself is still getting these insulins, trying to shove it in and shove it in. And it's like you're a frat party or living at a frat house in college. And you didn't know this, but everybody upstairs, downstairs, basement, outside ordered pizza. And so the pizza's delivered, insulin delivers the glucose, open the door, open the cell, bring it in, thank you. Then another one. Okay, thank you. Then another one, then 2, then 5, then 100. And pretty soon you're like, wait, stop, no. But these pizza delivery people, they only have one job. They don't know what else to do, like insulin. So it just keeps trying. So you lock the door and then they go to the window. And so you close the curtains and then they go around the yard and you lock the gate. That closing down is what your cell is doing, and you're becoming resistant to insulin.
Oh, that is such a good. I had such a clear picture of that. That is a really, really good explanation of insulin resistance. So, wait, how do you come up with all these amazing stories?
I am blessed to still love and get to treat patients. We actually have a nationwide telehealth company. We do a lot of weight loss, a lot of hormones. And so I just like explaining things to people. Our appointments are at least an hour. And I think, probably because this is the way I'm, set up, is that if I understand it, I'm more likely to do it. So I like
Yeah.
to explain to people why it's important and do it in a way that they understand. And I ask a ton of questions. Does that make sense? And if they say no, then I think about it again. And when you've been doing it for over 20 years, you just keep coming up with easier ways to understand.
Yeah, and that's great because I think, those metaphors really make it so much like it's easier to understand. It's easy for people to relate to. And it encourages like using other senses too, because we can picture like I was picturing those pizzas. I was smelling those pizzas too, and I was like, man, I could eat some pizza right now. But I was
Which
like,
turns to sugar.
I think I'm now every time I'm gonna see a pizza, I'm gonna think of insulin resistance.
There you go. There you
Yeah.
go. Well,
Oh,
and then you can use it as a tool. So what are some of the things that you can do to overcome insulin resistance? Well, one of the things that I encourage my weight loss patients to do is never underestimate the benefit of a 10-minute walk right after you eat, because your body just takes in this food, turns it to sugar, and then the body's going like, okay, what do we do with this? And they're like, I don't know. She's sitting on the couch. Maybe, okay, we'll just store it as fat. I don't know what else to do. Versus when you're going for a walk right after, all of that turns to sugar, or the body says, what do we do? It's like, well, those huge, great, big, awesome muscles called the quadriceps in her legs need energy to walk. So let's shove it over there.
oh my
Boom.
god. Yeah, this is awesome. I really, oh my goodness, I love this. I could definitely talk to you all night with all these. These are great. So, I know that these are quick interviews, but this has been filled with so many gems. Where can people find out more information about you?
My clinic, we have 3 doctors. Like we said, we do weight loss and hormones and total health. It's called BioThrive. So biothrivelife.com, and you can email us at biothrive.health, info@biothrive.health. And we are accepting new patients. So we just hired a new doctor, and if you like kind of having this way of a partnership and communication and looking at optimizing health instead of waiting for problems, we'd be honored to be part of your healthcare journey.
And this is great because I like the fact that you take so much time to explain to patients because that's one of the things we're looking at the data, and it's like the average patient comes in with 6 complaints, and the average doctor only has 15 minutes to address 6 complaints. And so you know what happens with that. The first complaint gets the first 5 minutes, and then you got to try to fit it in everything else, and it doesn't get addressed properly. So I love the fact that here with Dr. Tammy, you guys, you get somebody who will sit there and talk to you, explain everything, and explain it in ways that you can understand to make the changes that you need. So
Well, we try to listen to our patients. It's most people like that, but some people don't. Like I have a lot of professional athletes as patients, and they're like, just tell me what to do.
yeah.
I can do that too.
I like that. Awesome. Well, once again, thank you so much for taking the time to speak with us and giving you these wonderful pearls. That's amazing. I really appreciate it. Everybody go check out Dr. Tammy, and don't forget to tune in again next week for another episode of the Health Explained show. And also, when you're out there checking out Dr. Tammy's websites, don't forget to go check out wytv7.org, all their other amazing programming. And if you can, hit on the donate button, because every dollar that you donate, whether, it's a bunch of dollars or just a $1, it does make a change. It goes to community events and also additional programming. So once again, thank you, Dr. Tammy, for being with us today.
The best things in life are the people we love, the places we've been, and the memories we've made along the way. Don't let your pelvic health get in the way of your life. The Pelvic Floor Store, your resource for personal health.